Well, you certainly have a heartbeat, Rafiq, and you know, I'll remind our viewers that I am Mozart the doctor rather than Mozart the composer, and we're talking about innovations in ophthalmology today. In fact, I'd like to ask if Mozart again were a physician today rather than a composer and virtuoso, you know, what tools, techniques, and therapies do you think he would be using in ophthalmology?
So as you know, we're very much specialists in back of the eye.
Right.
I think being at EURETINA, I would expect somebody like Mozart to be using anti-VEGF therapy. And certainly, as you've probably seen over the last few days, a lot of debate about different types of treatment regimens.
Right.
And I think somebody like Mozart would be using a treat and extend regimen to make sure that he's delivering the best outcomes for his patients, whilst at the same time allowing them to extend the interval between injections. So that means less burden for them. So I think he'd be quite a smart sort of innovator, driving really the boundaries forward, adopting new ways of treating, but also technology. It's something I'm really passionate about.
Absolutely.
And, I think technology has a real role to play in how we actually optimize outcomes for patients and do better with what we actually have today.
That's right, and in fact, I was so pleased a few years ago to be involved with the sort of Google Glass project with Bayer to talk about the future of vision. So if we really think about the future of vision, where do you think we're headed? Are we headed into a world of artificial intelligence, of 3D visualization? What is out there for us?
So I think we've seen quite a lot of progress in artificial intelligence, probably over the last year, 2 years. Certainly we're seeing a lot of companies who are using artificial intelligence, for example, in diabetic retinopathy screening. So in the UK, where I'm from, there's quite a big movement in that direction. Also, beyond screening, we're seeing, for example, some work at Moorfields where they're looking at could artificial intelligence algorithms help physicians in understanding and interpreting OCT images. So I think if you fast forward, I believe we're going to probably come to a point where if you have or are at risk of some sort of eye condition, you're going to get screened remotely. That will be interpreted by an artificial intelligence algorithm, so you're going to get reassurance fairly quickly whether you need to go and see a physician. And then when you go and see the physician, they're going to be using different tools to understand what's the best way you need to be managed. So decision support software, interpretation of images, those are the types of uses I think for artificial intelligence in the future.
And it seems like just the right time, because it seemed in the past there was some diagnostic ability, but for many years there was no stopping things like AMD. It was just sort of trying to stall it, not leading to improved outcomes. We have both diagnostics and treatments now, and both of those seem to be improving into the future.
Well, I think we've made some really great progress over the last 10 years. And like you say, we now have effective treatments. Something we're working on at Bayer is something called the Vision Coach, where, a powerful insight for us when we first launched in diabetic macular edema, we began to understand that actually almost 50% of patients in some countries were dropping off treatment. Even though they're aware that they have the risk of going blind, and actually effective injections are available. So something that we've been working on is an app that patients can use alongside treatment to better understand how they're progressing, understand why they have this disease, some of the underlying mechanisms. So we think better patient education, greater engagement with their condition and their treatment will lead to better outcomes. So that's just one example of something that we're doing at Bayer, where we believe that sort of interpoint of product plus technology really has the potential to improve outcomes.
And I just am curious, because Elon Musk has brought up sort of the darker side of artificial intelligence, and the UK being sort of a mecca of intellectual thought. I wonder if at the highest levels of industry, there's anyone that's sort of wondering about, yes, near-term artificial intelligence could be a great thing. Is there something that we need to be careful about, though, in developing?
I think we need to understand exactly what is the scope of artificial intelligence. Because like you say, you often hear some of these scare news stories about, it could replace human beings. But I think when you think about the power of the patient-physician interaction, a lot of the physicians I speak to are adopting it and embracing it, to saying it's going to make me a better clinician. It's going to improve my ability to treat more patients and efficiently. And at the end of the day, that personal interaction is something you can't replace.
Absolutely. And you know, the other thought that has occurred here on the show floor is there are some exhibitors into robotics.
Yeah.
You know, so that seems like another dimension that we could get involved in, yeah?
So again, you know, we're hearing about some really great advances there. You know, I'm aware of one group in Switzerland who are actually developing a robot that could potentially do intravitreal injections in the future. But something that, again, we've had some very interesting interactions with some of the experts in the field. And you begin to realize, for example, you measured my heartbeat at the beginning of this interview.
Right.
The heartbeat itself can cause a slight tremor. And when you're dealing with something as delicate as the eye, the ability to remove that tremor using robotics could be significantly advantageous in how a clinician operates on the eye. So again, there's some really great opportunities, I think, of using these new technologies alongside existing skills that clinicians bring to actually advance treatment.
And you know, on the anterior segment of the eye, there's an interesting corollary, being that, you know, years ago microkeratomes were often used, and then they kind of started to switch over to femtosecond lasers to be more automated, precise.
Sure.
And yet, you know, the needle, I guess an injection needle, it's another thing which you could, I mean, doctors are doing that manually now.
Yes.
But perhaps there is something to automating that would be beneficial.
Absolutely, because again, you know, you reduce that variability.
Yeah.
You have greater assurance of they're injecting in the right place, and at the same time, you know, injecting the right volume. So there's many, many ways in which I think we can combine that skill of the clinician with technology to actually improve how we manage patients.
Wonderful. Well, Rafiq, thanks for joining us today. I'd serenade you, but as you know, my skills have languished, much like this piano over here.
Absolutely.
And instead, we'll bid you adieu, and thanks again for joining us today.
Thanks, Matt.
All right.
Take care.
All the
Cheers.
best.